Hello everyone, my name is Geetika Raj. I'm from UG category, and today my topic for poster presentation is oral manifestations of COVID-19. So, oral manifestations of COVID-19 is a very simple thing because nowadays in the pandemic of COVID-19, we all have some have gone through COVID and some who haven't gone through COVID but have heard the symptoms. So, everyone basically knows or has a general idea about what all oral manifestations happen in COVID-19. So we will have a brief look on some of the symptoms because we cannot cover all of them. There are many others which are not covered here, but these are just the most important or the very are seen mm, very often in the patients. So first of all, we can see loss of taste here. So loss of taste is the most common symptom that we have seen in the patients of COVID-19. It is called dysgeusia. One theory is that the SARS-CoV-2, that the SARS-CoV-2 strain, as with some other similar viruses, causes inflammation inside the nose that leads to a loss of the olfactory or smell neurons. Researchers also note that the expression of human cell receptors to which SARS-CoV-2 binds is higher in the nasal cavity and cells in the olfactory tissue. So basically, there is a loss of taste and loss of smell. So that is what is given here. And here there is a study given that 53% of the people who contracted COVID-19 had problems with taste and smell. So now if we move ahead with the second symptom, that is oral ulcers. Oral ulcers Oral ulcers can be, as we can see here, it is written mainly on the tongue, hard palate, and labial mucosa. So factors including drug eruption, vascularitis, and thrombotic vasculopathy secondary to COVID-19 were suggested as the causes for the oral ulcers. So oral ulcers can be seen commonly also, but during COVID-19, it's more susceptible for patients of who are facing or who have already gotten COVID to have oral ulcers, and they can be in greater amount as compared to when we get it in normal quantity. Now, next symptom that we can see or the next manifestation of COVID-19 is dry mouth. So here there's a study which is written as dry mouth appeared in 60% of the cases 3 to 4 days before as of the prodromal symptom, and in others simultaneously or 1 to 2 days after the onset of other symptoms. Basically, this point says that this dry mouth is one of the earliest appearing symptoms. So that means that if this symptom is appearing, there can be chances of the person who is manifesting COVID-19. So the dry mouth can also be called as xerostomia, could occur before all the common symptoms. It occurs before the common symptoms. Therefore, it can be hypothesized that it could be used for early diagnosis, quarantine, and treatment, because that is one of the most important thing that everyone needs to keep in mind nowadays, so as to prevent everyone else around them from getting COVID-19. Now, next is angular cheilitis. Angular cheilitis, as we can see here, that there is, according to care guidelines, we have taken one study, and from that we have taken this facts that according to care guidelines, a series of 17 laboratory confirmed COVID-19 case patients with AC is angular cheilitis. So what is angular cheilitis? The angular cheilitis is the mean onset of angular cheilitis. What we can see, when does it, first of all, how long does it take to occur? Mean onset was 1.82 days, that is 0 to 3 days, and the mean duration for which it lasted was 2 to 8 days. So how does this angular cheilitis happen? As we can see in this picture, it is quite clear that it happens at the edge of our mouth. And why does it happen? It happens due to the increased salivation reported by patients, and as the salivary enzymes can irritate the skin of the mouth corners, leading to macration and digestion. So now the fifth oral manifestation that we can talk about is gingival necrosis. We all know the necrosis, we all know the cell death that happens, we all know that COVID-19 has viruses due to which cell death can occur. So that's why what we have written here is bleeding occurred at gingival sulcus without provocation, and there was no detectable attachment loss. A clinical diagnosis of necrotizing gingivitis was made. So if we study more about it, we get to know that P. intermedia, that is name of a bacteria, is considered a major etiological bacterial species for several acute periodontal lesions, which alongside Fusobacterium and Treponema species constitute a large proportion of the microbiota present in necrotizing periodontal disease. So necrotizing periodontal disease is one of the most common disease that is faced in COVID-19. Now, hyperpigmentation, as we all know, hyperpigmentation is attached and interpapillary gingiva, we can see hyperpigmentation that happens because candidiasis due to long-term antibiotics, decline of general status, and deterioration in oral hygiene could be the cause of the white or the red patches or plaques seen in COVID-19. If we move ahead, there is excess salivation. So excess salivation, we can see that based on the data from our laboratories, we suspected at least some of the virus in saliva could be coming from infected tissues in the mouth itself. So basically, excessive saliva, salivary gland tissue of a patient with COVID-19 has specific sequences of viral RNA that showed cells were actively making new copies of the virus. Now, ischemia. Ischemia, we all know, is the blocking of the blood vessels. Patients had markedly increased levels of lactate dehydrogenase, C-reactive protein, and D-dimer. 3 patients died. It seemed that ischemic strokes in COVID-19 patients tend to occur as large infarcts and can be seen in patients with mild to moderate pulmonary involvement. And if we go ahead, rashes in the mouth, the mouth rash appeared anywhere from 2 days before the onset of other COVID symptoms to 24 days after, with an average time of about 12 days after the onset of symptoms. 29% of the patients had enanthin. Enanthin is basically rash inside their mouths. Their age was from 40 to 69. So basically, these are some of the manifestations of COVID-19, but there are some studies that are going on as to why these oral manifestations take place. Is it because of our damaged tissues or the viruses that are acting in COVID-19? Or is it because when we take the drugs for the treatment of COVID-19, due to the excess dosage of the drugs, these symptoms can be seen? So there are still studies going on, and it would be great to research, and I am also helping my hand in doing such a research. So hopefully in some years or soon there will be an answer to this question. Thank you. Hope you all have a great day.